Good afternoon, colleagues, and thank you for joining us for this webinar on how to write good abstracts as we prepare to make submissions to the Caribbean Congress on Adolescent and Youth Health. I am Dr. Shanti Singh-Anthony, Knowledge Coordinator for the Pan-Caribbean Partnership Against HIV and AIDS, PANCAP, based in Georgetown, Guyana. I extend to you a very warm welcome on behalf of PANCAP Director, Mr. Derek Springer, and the organizers and partners of the Congress on Adolescent and Youth Health. As you may know, this Congress is being held on October 15th to the 17th in Port of Spain, Trinidad and Tobago, under the theme Protecting Our Future by Promoting the Health and Well-Being of Adolescents and Youth in the Caribbean. At this point, I'd like to share a few housekeeping notes with you. Firstly, your mics are muted, and so if you have any questions, I ask that you type these in as the webinar progresses. We'll take your questions during the question and answer session immediately after the presentations. Secondly, we are recording this webinar. We will share the recording on PANCAP website for the benefit of the partnership. I will introduce a poll shortly on your screen. I encourage you to participate. Finally, you will receive via email a post-webinar evaluation. I encourage you to complete and share your thoughts and impressions. This will be useful for the organizers in framing the content for the Congress. Your feedback will also be useful to us at PANCAP as we aim to enhance future webinars. Today we have two presentations. Firstly, Ms. Leah-Mari Richards, who is a PAHO Public Health Consultant and a member of the Planning and Organizing Committee of the Congress. She will present an overview of the Caribbean Congress on Adolescent and Youth Health. I will follow Leah's presentation and provide guidelines and tips on how to write abstracts, after which I'll open up the session for any questions and comments. I now hand you over to Leah.
Good afternoon, colleagues. I hope everyone is well. Thank you, Shanti, for the introduction. So as Shanti mentioned, this is an upcoming Congress in October. The focus of the Congress is on adolescent and youth health. And when we say Caribbean Congress, we're not just mentioning the English-speaking Caribbean, we're also including the Spanish, the Dutch, and the French-speaking Caribbean. So please keep that in mind as we move forward. So my focus today will just be to give you a brief overview of the Congress and the planning that has been done thus far. There's still a lot more that needs to be done, and this is why we're reaching out to young people to help us move the agenda forward. So the next slide is just to give you an overview of my presentation. I will talk about three things: the Congress itself, the call for abstracts and the reason why we're having this webinar today, and ways that you can connect with us. So in terms of the Congress itself, what it really is a regional Congress. And why are we focusing on adolescent and youth health? Because there is need for greater investment in this area of public health. There's a lot going on with universal health coverage. Of course, there are resources for specific diseases like HIV. Sexual and reproductive health is also a very critical area. But we want greater investment into a cohesive and strategic approach to adolescent and youth health. So the focus of this Congress will be to mobilize greater investment and to align efforts. And we will do this in a 3-day meeting in Trinidad from the 15th to the 17th of October. Now, the structure of the Congress itself is like any other international conference that many of you have attended. There will be a range of sessions, both plenary and breakout sessions. There will be opportunities to attend skills building workshops led by specific organizations, regional as well as international. There will be key events, including poster presentations, thematic events on burning health issues, And then, of course, we will have a space dedicated to young people. And we're working with an organization that has organized such youth lounges or youth spaces in different international conferences. But of course, we wanted to have a Caribbean flavor. So this is just the beginning. We've just had preliminary discussions, and we will be working with the different youth ambassadors through CARICOM as well as other youth organizations to get their feedback on how this should be rolled out. In terms of expected outcomes, so what do we anticipate? Is this just going to be a talk shop? No, we are hoping that at the end of the Congress, we would have achieved 3 things. 1, regional commitment. We are working with regional bodies of young people and youth advocates, but also we're working with governments, with CARICOM, we're working with regional development partners so that we can align all of the various efforts on health. So that at the end we will have one document or a declaration that says specifically what we intend to do to achieve specific goals around adolescent and youth health. Secondly, we hope to have empowered champions like yourself. We are reaching out directly to you to get your involvement, to understand what you are already doing in your countries, and to see how we can work with you in terms of fulfilling your own agendas. And then thirdly, in terms of action planning, of course, we don't want a Congress to end without having a well-detailed plan about what we do next. And so in the end, at the end of the Congress, we're hoping to have regional action plans. So how have we engaged Caribbean youth thus far, and what are we intending to do? So we have a planning committee, as Shanti mentioned. This committee is made up of a number of different regional as well as national organizations. And then through this planning committee, as well as young people, we do have young people on our planning committee. Through this planning committee, what we are intending to do is push our communications through national and regional networks. So as you know, many of you are a part of PANCAP's Youth Advisory Group, or the IPPF affiliates, or UNFPA, or CARICOM, or the Caribbean Youth Council. I mean, there are many regional networks. And so we want to spread our communications through our partners as best we can. Moving back. And then through that, we also want to ensure that we are working, we are including workshops for youth and for youth leaders. We're doing digital media outreach and engagement, and this is something that I will talk about at the end of the presentation. And in the end, what we want is to ensure that your voices are best represented. And how is that done? That's done through the abstract submission process. What we want to do different in this Congress is we want to ensure that youth voices are represented and reflected based on the work that you have done or are doing. We do not want to predetermine the agenda of this Congress. We want your inputs in this, and the only way that we can get those inputs is through the abstract process. So this is why I will now move to the call for abstracts and what is this about. So some of you have seen on Instagram or via your own networks or via email this very colorful call for abstracts, or a one-page document detailing the actual call. So if you haven't received it, of course, I will leave an email address at the end of this presentation. Please email us and we can send you further details. The deadline for the call for abstracts is the 12th of July, as you see. The focus in terms of the tracks are mental health, substance use, violence and injuries, sexual and reproductive health and rights, HIV and STIs, nutrition, physical activity, sport and youth development, climate change and the environment. So these are 4 main tracks, and I will move to the next slide to show you some more detail about what they entail. So if you are to see here, this is basically, you know, all the topics for each of the tracks. And this will allow you to understand where you would fit. I mean, some people, their work, it's very easy for them to know that they fit within their sexual and reproductive health and rights track. But for others who are working, for instance, on social determinants of health, or working on employment for young people, or entrepreneurship opportunities, or social media and climate change, this might not be so easy. And so this is why we have not just the name of the tracks, but also some topics associated with each track. So how can you connect with us? I mean, we are a small committee trying to take on a massive undertaking, but with the internet and with email, we are available as much as we can, and we welcome your feedback. Welcome just an email to say, hello, I am working in X community in X country, and I would like to know more. We are available on Gmail, as well as on Instagram. You can follow us at ccah.2019. On Twitter, you can also tag us in any tweets that you have on ccayh.2019. And then finally on Facebook, just under the name CCAYH, which stands for Caribbean Congress on Adolescent and Youth Health. So as I mentioned, I just want to ensure that you guys keep connected with us. Please don't wait for any formal launch of a website. You have our contact information. You also know your local youth partners in your country. Please contact them and see how you can become engaged. We really are depending on you and your inputs. So today we're going to focus on the call for abstracts, because this is your way to influence the agenda of this Congress. So if you have a burning issue or you're working on a project and you think that it's very important for it to be discussed at a regional level, I definitely recommend that you submit an abstract. So I'll pass it now to Shanti so that she can help prepare you for the submission of such abstracts. Thank you, everyone.
Thank you so very much, Leah. I think that was very comprehensive and a succinct overview of what the Congress will offer to our youth participant. And I think more importantly, I appreciated the way that you laid out the expected outcomes of regional commitment, empowered champions, and regional action plans. But like you said, I think it's really exciting that we're at this point. Leah, can you let me know if you're seeing my screen? It's good. Okay,
Hello,
thank
I'm
you
seeing
very
it
much.
now. Seeing it now.
Thank you. I think I had a little glitch with the technology. So my focus today in talking with you is about writing an abstract for the upcoming Congress. What I'll do is I'll go through fairly quickly the presentation, and then I'll open it up for any questions. I can see from the poll that 32% of our attendees today have some experience in writing webinar. 68% reported that they don't have any experience in writing webinar. I want to say that though that I see this really as a learning experience for all of us involved, and so particularly for those persons who have experience in writing webinars, who have experience in writing abstracts, please feel free to share as well. I encourage everyone to keep typing in any comments, any questions that you may have. As you may know, really, an abstract is a short statement that gives your reader, and in this instance, the reviewer of the Congress, a comprehensive yet very concise understanding of the work that you're doing. So as an outline today, I want to talk with you very quickly a little bit on thinking through how do you go about selecting a topic. I will discuss briefly the sections of the abstract. And in this instance, it's based on the guideline that the Planning Committee of the Congress has put together. I will share the guidelines very quickly, the Congress guidelines, and Leah touched on those, the tracks and the topics, and then I'll open up for some question and answer. Again, I encourage you to type any comments in, any clarifications that you may have. Like I said, I see this as a learning experience for everyone involved, and so please feel free to add as I continue with the presentation. So obviously, when you're thinking of submitting an abstract, you have to think about what area of focus and what do you really want to write about. In this case, we're writing for the Caribbean Congress on Adolescent and Youth Health. And so we've just heard from Leah, and we've received some broad guidance, which I'll quickly go through in subsequent slides as well. However, in selecting a topic for your abstract, consideration must be given to the following things. So the topic or the program should have some primary findings to share, and you should be able to discuss some lessons learned, particularly if you're describing or writing an abstract that focuses on implementation experiences, let's say. When submitting an abstract to a conference, choose an angle or a scope that really aligns with the conference topics, and you've just heard what those are. And choose, when you think about your topic, think about how this could be applied to your audience own program. And in this instance, while your primary audience in some ways would be the reviewers for the Congress, your audience will also be participants at the Congress itself. And when you think about your topic and you think about the angle and the scope and so forth, think about how can this be replicated by your audience? So persons who will be at the Congress, how can they use the findings and the recommendations that you're sharing and be able to replicate that in their own context? So in other words, think about a topic that you think will be useful to your audience. Leah touched on this, and so there are 4 broad topic areas that the Congress has outlined: mental health, substance use, violence and injuries, nutrition, physical activity, sport and youth development, sexual and reproductive health and rights, HIV and STIs, climate change, and the environment. However, when you think about your topic and what it is that you want to write about, the Congress has also given 4 broad areas within which you can fit these topics. So scientific research, program and policy interventions, social and political activism, and implementation research. Now, once you have selected your topic, it's time to really move on to the abstract writing. And here is where I think it's really important that you think through a number of questions and be able to provide answers to those questions when you think about your abstract. So what it is that was done, how did you actually do it, what did you find, and why are these findings useful and important, and again, to your audience, which in this instance will be participants at the Congress. Based on those questions, the Congress has outlined different sections of the abstract, and so each abstract that you will write and submit should have a title, a background, methods and actions, results, and conclusions. I'll talk a little bit about the title. So in relation to the title, it really is a statement that conveys the main ideas of the topics of intervention, whether it's policy, advocacy, implementation, or research study. A title really should convey the main topics of your study. It should highlight the importance of your research. It should be very concise, and it should attract your readers. In this case, it will be the persons who are reviewing your abstracts. To achieve this in terms of your title, I would like to suggest that you limit your title to 20 words or less. In fact, you should keep it short, but don't make it too short. Use words that you think researchers may be looking for. In fact, you can think through some keywords that you may wish to use. I would also suggest that you use descriptive terms that tell the core content of the abstract. So what makes it interesting? Use a descriptive phrase rather than a bland, full statement. Try to answer the questions in your title of who, what, when, where, and why. Again, think about your audience. In this case, your audience will be your reviewers of the abstract, but it will also be your Congress participants. So the title really is the main thing that will draw the abstract reviewers in initially on your abstract. And if your abstract does get to the point of being accepted, it will then draw participants of the Congress to your presentation or to your poster. If the title isn't compelling or informative enough, The participants of the Congress or the reviewers may very well scan over it and select a different abstract that has a better framed title. Finally, I will say, and this has worked for me, write your title last. I've done this on many occasions, and it really is easier to come up with a title that's engaging and informative once you would have fine-tuned the content of your abstract. So think about that. Think about writing your title last. I would also suggest that you write, I would say, 2 to 3 versions of the title. So you play a little bit with the wording. You try to fine-tune the wording of the title. Share it with maybe your colleagues, with other researchers, and get feedback. This will allow you to really put together a good title and finalize your title for your abstract. In terms of writing title, what I want to share with you at this point is an example are different versions of a title. And so the first version would read, does vaccinating children and adolescents with inactivated influenza virus inhibit the spread of influenza in unimmunized residents of rural communities? And I actually took this offline as an example. I would say that the first title has too many unnecessary words. So an attempt was made to really fine-tune the first version, and a second version of the title was developed. Influenza vaccination for children, a randomized controlled trial. I would say that this title really doesn't give enough information about what makes this abstract interesting. And so a third title was framed, effect of child influenza vaccination on infection rates in rural communities, a randomized trial. I think this is a more effective title. It is short, it is easy to understand, and it really does convey the important aspects of the research. So I thought I'll share these 3 options with you so that you can get an idea of what reviewers look for in the title of an abstract. I'll move on to the background information. So in the background section, it's really important for you to provide a concise summary that really tells the story to your audience. Really thinking through what was the motivation for the project, the program, the activity, the study, why was it started, identify the problem that the program is addressing. What was the time frame and location of the program? What did you hope to achieve and to what goals and objectives? If it is a research or a study abstract, then the background should be addressing things like, why was it important in your work? Does it fill any gaps in knowledge or research? What is the content? What are the objectives? And you may even go ahead and include a short statement of your hypotheses. Your background, however, should be well balanced. So if you're looking at experiments or studies, you need to be able to include in your background studies that have conflicting results on the questions that you're examining. So you should really be citing studies that have a variety of results, so positive results and negative results. In every field, you should aim to cite references that are no more than 10 years old if possible. So more current evidence should be cited. So your background should include current information. Be sure to cite the first discovery or mention. So if we're talking about HIV and we want to speak about the Caribbean, so the first case in HIV. But in fact, try your best to stay within that 10-year period that we're talking about so that our evidence can be current. And probably the most important requirement, I think, in your background information would be to make sure that the studies that you cite will be strongly linked to your research question that you're answering and be related to that research question. So there is that link and it's relevant. Once you would have provided background material and stated the problem or the question of your study, you need to tell the reader the purpose of your study or your intervention, programmatic intervention. Usually this could be, the reason is to fill a gap in knowledge or to answer previously unanswered question. And I'm sorry for bringing in some clinical examples. But if a drug is known to work well in one population, but it has never been tested in a different population, then the purpose of the study could very well be to test the efficacy and safety of the drug in a different population. The final thing I would suggest is to include at the end of your background a clear and exact statement of the aim of your study or the objectives of any specific initiatives that you're describing. You may also want to, in a sentence or two, talk about how you conducted the study. And finally, one key tip, keep your background as short as possible because you have a word limit for an abstract, which in this case is 350. And so keep your background as short as possible, as you'll need to have more words under your method and results section. So moving on to methods and action, the Congress recommends that if it is a study or research, that you explain your methods such as study design, what was done, by whom, how, and where, what measures were taken, and how were the data managed. If it is a programmatic submission or activist submission, then think about who and what provides the structure for this program, what are the major activities under the program, what interventions were used, who were your key audiences, were there any key population? And so as you think through programmatic or implementation experiences for submission, you need to be able to highlight some of those under your methods and actions. In terms of results, it'd be important for you to share very clearly the findings and the outcomes. And if you're thinking about submitting an abstract based on implementation, then it'd be good to also include any important lessons learned. And so what you'll need to clearly define and present under the results section would be analysis of lessons learned and good practices, some of the achievements and the changes that you have seen, summarize any specific results that support your lessons learned, and be as specific as possible about your key findings. For studies where you have data, it would be important for you to talk about what did you find, what did you discover, what did you achieve, not just in subjective terms, but also in form of data. How significant were your findings? Also, for some study with data, you may want to consider the use of subheadings to separate the results in order for your reader to get a better understanding of the results. So you can either determine, if you use subheadings, whether you'll present them in a logical order with the more important findings at the top of your priority, as an example. In terms of conclusion, I think it's really important that you clearly write and provide answers to the key questions that you've set out. So in this segment or this section of the abstract, it'd be important for you to talk about the significance of your findings or the outcomes of the program that you described, or the studies or the research. What's the implication of those findings that you're seeing? And what's the future implications, including what are your next steps? The conclusions should support the findings and lessons learned, like I said, if it is a programmatic abstract that was presented in the previous slide. The conclusion, however, shouldn't seem to come out from nowhere, but in fact, you should have your supporting evidence and experience in the sections, in the related sections, so that you can pull from those sections to form your conclusions. And so again, your conclusions should really think through what are your overall findings, what do they mean, how could your methods be improved, is this work part of a bigger piece of research or strategy, and what are the suggestions for future work. So in terms of the Congress guidelines, the Congress is recommending that the abstract be no more than 350 words. The 350 words, however, does not include the track number, the title, the authors, or the institutions. There's very clear guidance in terms of layout. So it should be done on letter size, portrait orientation, black font colors, Times New Roman 12 points font, and single line spacing. Again, the abstract should have the following sections. So it should include the track number, the title of the abstract, the name and email of presenting author. So only one person, important, only one person can be listed as the presenting author. And then you have the names of other authors. And then you will have the body of the abstract, which will include the background or your problem statement, your methods and actions, your results and conclusions. Some very general guidelines. I think it'll be important for you to, before you start, be very clear on what it is that you want to present, what aspect of your work, and what the audience will find most interesting and useful. So going back to the earlier slide about how do you think through selecting a topic. I think your abstract should be concise and it should be a powerful summary of your program, your intervention, or your study. It would be important for you to keep the language correct, simple, clear, professional, and where needed, particularly in the case of research, keep your language very scientific. I encourage you to avoid any jargon or overcomplicated words and sentences. And in fact, I encourage that you delete as many unnecessary words and sentences as possible. Use short sentences. Minimize the use of abbreviations. If you do have to use them, make sure that you place them in parentheses after the full words for the first time as they appear in the text. I'd encourage you to exclude any unnecessary details and to test your abstract before submitting it. So ask someone else to read it and tell you what your work is about or what is the abstract about. Does it make sense? Is it well structured? Do you understand the program and the findings? Will the topic add value to the field? If the person you're asking to read this is not able to explain to you clearly, then you may need to go back to your abstract and do some revisions. When submitting the abstract to the conference, again, be sure to follow the abstract guidelines. Importantly, it may seem very mundane, but be sure to proofread your abstract several times. Use spell check, use grammar check. Have an extra eye to look at your abstracts and review, get feedback from your colleagues. And so revise. Once you do that, you proofread, you get feedback, revise, and revise your abstract. 350 words may not seem like a lot to write, but once you begin to think through writing and putting an abstract together in a stepwise manner like we just talked about, it actually takes a good bit of writing. It takes quite a bit of revising. So I encourage you to start early. Try not to wait last minute. Avoid any last minute rush. And I say this very much mindful that the date of submission for abstract to the Congress is July 12th. And so we're not very far away from the submission deadline. For the submission, again, this was shared by Leah. Here is the email to which you can make your submissions. The submission is due on July 12, 2019. And for any additional information, you can contact the Congress organizers via the email that's here on this slide. So thank you very much. I can see that we have questions already in, and I ask that you keep typing your questions and comments in. At this point, I'm going to take the questions. I can see that there's at least one question. If my research was done to fulfill requirements for a program, will I need to mention the research supervisor in my submission? So my take on this will be that if your research supervisor is mentioned, it will likely be as a co-author or as a secondary author to your to your abstract submission. I don't think you necessarily have to mention your research supervisor by name. If in your background or if in your method you have, let's say, an organogram of who would have participated, roles and responsibilities, and those kinds of things, then your research supervisor may be there, but you don't necessarily have to mention your research supervisor by name. I don't know if you have any comment to that question, Leah.
No, I think that what you suggested is fine. I mean, you want to ensure that whoever is written as author and co-author are, reflective of the specific roles in the abstract preparation or in the research. So yeah, I think what you said is fine.
So I think we have another comment here from Sarah, who submitted a question saying thank you. I have a comment here from, my name is Faye from the Youth Advisory Group of the UNFPA Suriname. We're very excited to participate. Is it possible for us to get this PowerPoint presentation for future reference when writing our abstract? And the answer is yes. We will send out the PowerPoint presentations, including the presentation that Leah presented. So Leah, if you can share that with us, we will send those out to all of the persons who registered for the webinar and all of the attendees this afternoon. Anything on that, Leah?
So absolutely, the presentation would be available. Shanti will link it along with the webinar recording, and just for everyone to just add us on your Instagram, your Facebook, and your Twitter, because that's how we're going to start pushing out communication. So it's faster that way until we have our website built. So via social media is the way for you to find out more.
Yeah. I don't see any more questions coming in. But I note, I'm going to go back again to the poll, that 68% of our attendees this afternoon have never written an abstract before. And I trust that while this was a really very quick overview on how to write an abstract, I trust that it will encourage you to make a submission to the Congress. We're really looking forward to get an interesting variety of abstracts and a large number of abstracts coming in. As Leah said when she presented, this is important for us to really get your feedback so that we can be able to frame the content for the Congress. So I really hope that while short, it has been useful, particularly to those persons who haven't written abstracts before. Any additional comment from you, Leah?
Just one comment in case people joined late, and I'm glad we had the question and comment from Suriname. This is open to the English, Dutch, Spanish, and French-speaking Caribbean. So as a last and final word, I would encourage persons to submit abstracts in their mother tongue. Feel free. We are allowing 4 languages, and we do have reviewers who would review in those languages. So if language is an issue, just know that we are accepting in 4 languages. So that's it. And then good luck to everyone, and hopefully we'll see you in Trinidad.
So then, in fact, language isn't an issue, Leah. This is good. I have another comment from St. Vincent and Grenadines, who is saying that we will be getting this presentation. Absolutely, you'll be getting the presentation. And as a reminder, the recording of this webinar will be posted on PANCAP's website. We will send the link out, so you can also share the link with your colleagues. If they're not present here today, they'll have an opportunity to listen to the webinar and see the presentation. I have another comment that's saying that this is very exciting. I had initially thought that my little research was insignificant. However, when news of this conference came out, I realized that it can be groundwork for more in-depth work. So great initiative. And I want to congratulate Leah and the Congress team as well. I believe it's a really excellent initiative. Very often we hear in the region that we do really good work. We do a lot of work, but we don't necessarily document and share. And I think this is really exciting that, as you said, Leah, it's the youth lending their voice to SRH, to HIV, and all of the other issues that will be discussed at the Congress. But I also think it's a really great initiative to build on documenting what we're doing in the Caribbean and sharing our work in the Caribbean. So at this point, I think I was about to bring the webinar to an end, but I think we have another question here, another comment. Thank you. It will assist some of our adolescents who cannot be here today, but who has a presentation also in Barbados. And so yes, the webinar will be posted on PANCAP's website, and we will be sending out the presentation to all of you who are present and to persons who registered or are unable to be here with us this afternoon. So at this point, I'll bring the webinar to an end. I trust that we'll see an influx of abstracts to the Congress, as many as possible. Make your submissions. I just want to remind you, please start early. Allow time to proofread, revise, and submit by July 12th. Thank you again, Leah, for providing a really succinct overview of the Congress. I want to say special thanks to the Planning Committee for collaborating with PANCAP on this webinar. For all of our colleagues present, thank you for participating. We look forward to your abstract submissions. I did say, as a reminder, the webinar was recorded. I just want to repeat that. It will be on PANCAP's website. Once the webinar is closed, you will receive a post-webinar evaluation. We'd highly appreciate your feedback. So please do take a minute or two to give us your feedback. I want to encourage you to stay engaged with the regional response. Keep following the updates from the Congress. Look out for the outcomes and the decisions that will be coming out from the Congress. Follow us, PANCAP, on social media, Facebook, Twitter, and visit the PANCAP website for more on the regional response. I want to encourage you to also look out for our announcement of a post-International AIDS Society Scientific Conference mini webinar series in collaboration with PAHO on treatment updates that will be coming out of that International AIDS Society Conference. Again, thank you everyone for joining us. We look forward to receiving your submissions, and have a good afternoon, everyone.
Thank you. Take care.